Okay, so cleaning and disinfection. I wasn't going to go into this a lot, and there'll probably be questions. There's some at the break. But when it comes to cleaning and disinfection, there are a few things. Again, this is facility specific. What a kind of high volume farm that has a lot of high risk horses, or that has brood mares, or has an isolation facility, or has foaling stalls, or that has kind of sick horses continually, those have a lot different approaches to cleaning and disinfection. It's kind of like vaccination. You have targeted cleaning and disinfection. Some places are going to be really, really strict. Some are going to be a lot more relaxed. My pony that lives out in the field with the sheep in the little shed, there's not a whole lot of cleaning and disinfection that gets done, besides sunlight and rain. That's really my cleaning and disinfection program, because it's a low-risk operation. If she was foaling, if she was sick, I'd change some other things. But cleaning and disinfection are two different things. So if we are going to do cleaning and disinfection in a barn, we need to think about, okay, what are we trying to kill? And what kills it? Disinfectants are like antibiotics. Some are better than others. Some work well against some bugs and not against others. And cleaning and disinfection are separate things, because cleaning is getting rid of all the dirt and the debris and the poop and everything else. And disinfection is killing that residual bit of bugs, but we can't disinfect things without cleaning. So you can take bleach, which is a really good disinfectant, and you can dump it on the ground. But if there's a pile of manure sitting there, or it's a dirt floor, that bleach is just going to do nothing. It's going to get inactivated by the debris. So we need to think about cleaning and disinfection. And this really probably is 45 minutes to itself, but general concept. Think about what you're doing for cleaning and disinfection. Think about why you're doing it, and then there's some resources to help you do it right. Good cleaning, use the appropriate disinfectant for the appropriate situation. And if there are any specific questions about that, when we get to the end, in the question period, feel free to shout out. So something else you can do, a lot of it's just stepping back and thinking about things. So an example, so our hospital, we have a really tight infection control program. We have one of the more aggressive infection control programs anywhere. And we do a lot of research and surveillance of things. And one study we did over the summer was in looking at cleaning and disinfection in the small animal clinic. So the way we did this is we took this fluorescent dye that you can't see with the naked eye, and we went around different days and we put the dye on different surfaces throughout the hospital. So you can't see it's there, but if you shine an ultraviolet light on it, it glows. So we put it down there. The next day we came through, checked all those spots. And if the dye was still there, that site hadn't been cleaned. If the dye was gone, it had been cleaned. So we're trying to get an idea of just baseline cleaning rates. And one of the things we noticed was computer keyboards and computer mice, 80+% of those hadn't been cleaned by the next day. And it's important for us because hands touch there, and hands are, again, the 10 biggest things for disease transmission. And we're electronic records based. So people are always on the computers entering things. So go to the patient, go there. So if they're not washing hands in between, that's a big concern. So we thought about that and said, well, duh, we don't clean them, right? Who cleans keyboards? I don't know. Does house cleaning clean them? No. Do clinicians clean them? No. Well, maybe we should think about that. But it's one of those things we do a lot of things. We've evolved a lot of things over time, but it's just an area we hadn't thought about. But when you step back and think about it or do something specific like that, we realize that this is kind of this duh level infection control thing, just wiping down a keyboard that we hadn't done. And we're trying to figure out best ways to do that. And it's not going to be keyboards in the barn, but a lot of this is kind of stepping back. So beyond your day-to-day activities, kind of go there, just sit there and look around. From an infection control standpoint, things that you do, things that people are doing, the way it's set up, you might realize, okay, that looks kind of strange, that looks dumb, that looks good. What can we do? And it might be some of those things you can't address, but once you step back and start thinking about it, you can maybe find some issues that are worth addressing. So look at your facility with an infection control mindset. The layout, movement, mixing, veterinary care, consistency of veterinary care, things like that. Think about high-risk situations and think about how you can reduce the risk. Part of it's even going into here. Okay, well, here's a stall. So is this a stall? This is a foaling stall. So this isn't ours. This is just one place. So this is a high-risk stall. So we want to have really clean. Well, what can we do about this? We've got a lot of wood down here that's not sealed. So disinfecting unsealed surfaces is very difficult. Disinfecting bare wood is impossible. So we like to seal it with paint. So down here, these areas aren't really getting disinfected. This flooring itself is going to be impossible to disinfect. What can we do about it? Well, make sure there's good bedding in there. We can maybe put in some mats that go over top. We can paint around here. Some things that are actually not that hard to do because this is a high-risk stall because we've got foals being born in there. If it's a stall that's got your normal, low-risk, run-of-the-mill horses, then maybe I'm not worried about that at all, but I'm going to think about that maybe if it's a high-risk stall. Same thing here. We've got paint that's been chewed off. Another couple coats of a good sealing varnish on that paint will help let me disinfect that if I'm going to disinfect it. If I'm never disinfecting this area, then maybe I'm not going to be as worried about it. But little things like that you can think about. Twitches. if there are twitches on the farm. So bigger farms might have twitches that are used on their farm. And in some ways, it's good if you have your farm-specific twitch, so you don't have your vet twitch coming in and out. If we think about what do twitches do, well, they go right here, right? And what lives right here, potentially? All these bugs I've been talking about today. Herpes virus, influenza, strangles, MRSA. And twitches are really hard to disinfect well. If they're rope and wood, they're almost impossible to disinfect. It's a big battle for us to figure out how to actually manage twitches. We don't know whether they transmit any infections, but it kind of makes sense that they would. So think about that. If you have a twitch on the farm, what do you do with it? How do you clean it? If you use it for a high-risk horse, what happens? If you have a horse that's got a runny nose, what happens to it? Because too often these things get done, it gets hung back up on the wall, and then someone uses it again the next time. So common use items like that. It could be a bucket, it could be anything else, it could be a muzzle. Probably not going to have tubes in the farm, but things like that, they're going to potentially go multiple animals. What can we do? Well, muzzle like this, well, maybe it's not a big deal. If it's going back on the same horse every day, if it's a grazing muzzle, then maybe you just need to clean it periodically when it looks dirty. If it's going between horses, then certainly we need to pay more attention to it. If it's going between horses and one of the horses was sick before, then we need to pay a lot more attention to it. So it's identifying some of these high-risk scenarios. Develop an infection control plan. So again, it's that whole risk assessment for your facility. And coming back to this again and again, but it's a lot of it, if you can go home and think about it and jot down a couple points, and ultimately you don't need to go home and write the 100-page infection control manual. But if you can identify a few points and over time start thinking about things. And ideally start writing them down, because it makes it a lot easier instead of reinventing the wheel. Because if you do it, maybe you'll end up asking your vet some questions about this, or maybe you'll go online and do some research on it, and you'll find an answer that you want. So write that down or print that out so you know where it is. So what do you do when new horses arrive? What do you do when a horse gets sick? What's your vaccination program? What's your kind of general cleaning, hygiene, all those other practices that you do? Work with your vet, looking at risk, assessing risk, targeting your vaccination program, targeting your deworming program, kind of optimizing all those three areas I talked about before, that reducing exposure, that decreasing susceptibility, and increasing resistance. Realize you can't do everything. Like I said, our hospital has a really kind of aggressive infection control program. We're always finding things that we can do. Sometimes it's because we've got a new bug that's come in, or a new concern, or we've got a new patient population, or just something we haven't addressed before because kind of get the high-profile items first and we work our way through, or something we haven't thought about before. So don't need to go from 0 to 100 in a week. If you can go home and do one or two things, that would be great. If you can take one or two concepts away, get that established, see, okay, it works, not hard to do, let's try something else. People like it, get the concept around that we're doing something new here, and ultimately evolve into a program. So kind of the last infection control concept I've got, I guess, is things change and change with them. If we think about diseases that we encounter, there are a lot of new ones. Emerging diseases are a big concern. Look at West Nile virus. That came out of nowhere, right? That came out of nowhere, 2001-ish. We had no concern about it, all of a sudden, bang, we had West Nile virus. You get various shifts in other types of infectious diseases. We get multi-drug resistant bacteria. There's some pretty bad equine diseases that have evolved in certain areas. So we have to be aware that what we've got right now isn't what we're going to have in 5 or 10 years. You can be pretty confident that if I do this talk, hopefully I can still do this talk in 10 years, there will be something else I'll be talking about. Strangles will still be here. Herpes virus will be here. Herpes or salmonella will be here, but some other bad things might be here. Now, this is an example. This is not something we need to worry about ourselves, but this is a great example of why we need to be proactive. This is Hendra virus. Many heard about Hendra virus. So this is a viral disease in Australia. If you're in Queensland, you know Hendra virus really well, and you are scared of Hendra virus. This first emerged in the late 1990s and infected a few horses, and these horses typically died. Very severe respiratory and neurological disease. And one of the problems is, in the first couple of horses, 2 people died with them. The spouse of a veterinarian who helped with a postmortem, and I think the trainer who had really close contact with this. And this is a disease that kind of comes up, it's come up and gone away over the last little bit. But the last 3-4 years has been much more common in Queensland. It's starting to expand its range. And it does the same thing. It makes horses very, very sick. It often kills them. And the problem with respiratory disease, they often get nursed really closely. And vets may be putting endoscopes down, people are handling them closely, and veterinarians are dying from this. Not too many, but there have been a few vets that have died from this. And horse owners are very, very concerned about this, obviously, because they're getting exposed to, there's the risk of severe disease. Fatality rate in people is over 50%. So it's not a disease you want to have. Results in farm quarantine, really aggressive measures. This is a disease that actually comes from fruit bats. Bats have a lot of weird things in them. So fruit bats, the main thing is when whatever fruit bats do in the equivalent of foaling. When fruit bats make new fruit bats, they contaminate the environment below that. And they also urinate out a lot. So if you've got fruit trees and a horse pasture, it's a bad combination there. Actually, you have very few of those combinations anymore in Queensland because any fruit tree or any roosting spot is gone. But you've got situations, you've got these bats roosting in these trees, they're contaminating the ground, the horses are grazing there, they're getting exposed. They're bringing it back into the farm, and they're exposing other people. This one came out of nowhere, right? No one's going to think that you've got this weird disease in fruit bats that are infecting horses that can kill people, and kill both at very high rates. Are we going to have Hendra virus here? No. Right? We don't have fruit bats in Ontario. It's going to take a lot of climate change for that to happen. But who's to say something else weird isn't going to happen? Look at all the weird infectious diseases that have happened in the last 10-ish years. Look at SARS. That SARS actually relates to bats too. I guess bats are the root of all evil when it comes to some infectious diseases. But bats to civets and some other weird critters made the jump into humans. We know SARS can also infect some of our domestic animals, cats and ferrets. There are a lot of diseases that are lurking out there that can work their way into the horse population or adapt into horses. So again, not to scare you here, just to be aware. Another reason to do basic infection control things because you don't want to be the index case. You don't want to be the cool first case in the medical journal for the resident in Mount Sinai that gets talked about the first fatal infection of disease X in North America caused by horse contact, because you don't want to be the first fatal case of anything, right? You don't want to be the first case of a lawsuit either or a medical record. So just to be aware, the more baseline good infection control practices we have, the reduced risk we have of something new coming onto the farm or spreading onto the farm